Hey guys, so this is part two in an ongoing video series on my distal tendon tear, surgical reattachment, rehabilitation, and comeback process. And so in the first video, I kind of wrapped up talking about some exercises I was able to do with the bad arm. And again, these are not me, being an idiot and, trying to find things that just, well, just give this a go. These came from my physical therapist. I took them to kind of a different level, but again, all in an intelligent way, hopefully. And so the first is, and again, the thing that you will struggle with most likely if you're having this procedure done is the nerve. Since like I got it right now, so it's from the tip of my thumb all the way to the elbow. It's pins and needles, feels really weird, and even like throughout the day, if I do something like the other day, I was like holding a plate, okay, not a plate with bricks on it, like a plate with like some pizza on it, and I just feel this nerve like ding, and it freaks me out. It's happened, things like that have happened a couple of times where I'm like, oh my god, just pushing, and again, I don't think you're gonna do something like that holding like a plate with a piece of pizza on it. I think it's just your nerves are slowly but surely coming back. I learned the other day that nerve tissue recovers very, 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 very slowly, to the tune of like 1 millimeter per day, or I'm sorry, 1 millimeter per week. And so my metric's not too sharp, but I think that's maybe, let's say 10 millimeters for a centimeter. So 3 centimeters, yeah, so like 30, is that 30? It's embarrassing, but yeah, I think it's basically, it would be like an inch a week, or yeah, an inch every 30 days. Dude, I think I just totally butchered that. But at any rate, recovers very slowly. Everything I've read that, that comes back, that's perfectly normal. It's weeks before all those nerve sensations kind of dissipate. So, but just, you never quite get used to it. And one of the things that's been frustrating for me, I say weird, but that's my way of saying, frustrating, is that some days it's great. Like I almost have no nerve sensation there at all. Everything's awesome, and then like the next day it'll feel like it did a week earlier. So a little frustrating because on the one hand you're like, hey, I think I'm kind of making progress here, and then the next day you're like, have I made any progress at all? But that's the way it goes. And so one of the first things that I started going to PT, they gave me a tennis ball to squeeze to work on finger strength and grip, and just kind of getting some motion going in the forearm. And so, I was assured that, anything you're doing with your grip is totally fine. You're not risking re-injury or anything like that. So I went and started picking up these Captain of Crush grippers. A lot of folks are probably familiar with these. This is the trainer. It's the 60 pound, like the littlest one they got. And I started with that one. I love their recaps on, kind of how they describe each level of gripper. It's like the, this one's for like senior citizens, rehabilitation and warm-ups, like basically like this is which for what I was dealing with, that's exactly what I needed. And so I got this one in like a 100-pound one. But I remember when I first got this, it was like, I think I closed it a few times, but it was, dude, not cool. It was pretty depressing, honestly, like how difficult it was and how stiff everything was, and particularly like my pinky finger and my thumb just did not want to close with any type of force. But just like anything else, within a couple of days, I would get them out like probably every 2 or 3 days, and over time was able to progressively build that up. It still feels really strange. I'm up to like it's the 1.5, I think it is, like 170 pounds or something, and I could bang that out, a bunch of times on that right hand and left. So I have like I'll work up to that top one, and hammer it out once or twice, 2 rounds, 2 sets, if you want to call that, and then I back them all down to just get a ton of blood flow there. I finish with this little trainer just as many times as I can, and again, I just want to, my surgical site is, it's right there. I don't know if you can see that scar or not. Barely. I've got a great scar. Very, very thankful for that. Not necessarily because I care what it looks like, but because I'm told that that's an indication of how healthy and clean the attachment is healing as well. So Don't know how much truth there is to that, but I'll take it. So, yeah, if you're doing a ton of that grip work, again, that's going to drive some blood flow and get the circulation moving in there, which is where that reattachment is taking place. So that's going to be a great thing. The other two exercises were wrist flexion and wrist extension with a little dumbbell. So they started me with like a little 2-pound dumbbell there in the PT room, and at home I've got a little video watching a dude do wrist curls. Is pretty boring, pretty humbling, but it is what it is. That's what I'm able to do with this arm, so I'm going to do that with this arm. The one thing I will say, two just pointers, and again, they'll tell you this at PT hopefully. If not, just something to remember. One, make sure that arm's completely supported. You'll see I'm doing it on a bench. I make sure like my whole, the only thing that should be hanging off that bench is your wrist. You don't want to inadvertently have to engage the bicep at all. Everything should be just on the wrist, and the forearm should be moving that weight. And the other thing, and luckily I did this while I was at the PT guy's office, so he saw me, he was like, whoa, don't do that, and corrected me. But when you go from flexion to extension, and again, I might be getting those terms wrong, but whatever. I would take the dumbbell and just turn it over, right? Which is like one of the last thing I would do some supination with a weight in my hand, which is like one of the worst things you can do with this injury and potentially re-injure it. And so he's like, no. He's like, you take the dumbbell out of your hand, turn your wrist over, and then put the dumbbell back in your hand and begin working on your extension. So good call. But again, one of those things like you wouldn't know unless you learned it the hard way or someone told you. So make sure you take the dumbbell out of your hand, turn your hand over, put the dumbbell back in your hand, and get back to work. And again, for the hand stiffness and everything, that feels really good. Again, you're talking like sets of 20 and stuff. Just, this is not training. This is rehabilitation, right? It's two different things. This is not trying to see how much you can do a wrist curl with. Like, who gives a crap about that anyway? It is truly just to rehabilitate the area, promote some healing to the reattachment point, and keep your mobility and everything going. The last thing I'll add is just, and this wasn't anything the PT gave me, this was just something I did. After watching Andy's video about how much shoulder tightness and stiffness he had from being in that sling for 6 straight months, I was not, I'm barely 5 weeks out. I'm not wearing the sling right now. I'll wear it, around all day today to just rest my arm. But, if I'm sitting, or I make sure to just kind of let it, again, doing the hang thing. But I would make sure I would move that shoulder. I would kind of shrug like that. You can do that with that sling on. You're not putting any tension on the bone, because it's in this position. You cannot re-injure this arm. If you are in your sling and you are in this fixed position, you're not holding on to anything, you cannot injure that arm. And I'm telling this to, again, anyone dealing with what I've dealt with, and I'm telling it to myself too, because even knowing that's the case, it's just scary, especially those first few days. Like, you don't want to do anything that might, mess something up. And then after that, I would still, in my sling, I would just lift my arm up a little bit. And I'm not talking about trying to see how high I could lift it. I'm just talking about I would just move my shoulder up and down. And again, with that arm perfectly at a perfect 90-degree angle, I would just raise it up. And again, this is not exercise. This is just straight movement to keep from that shoulder joint starting to kind of lock up and losing all its mobility and kind of forgetting how to do what it's supposed to do. And so I do that all the time. Part of my training, I'm going to do a video on the exercises I am doing that I'm actually lifting. And a lot that involves a shrug with a safety squat bar. Again, I don't care about the hypertrophy. If it's it's something that I can do. It is zero risk to injuring my arm. That I think also, again, just helps this shoulder stay loose, stay mobile, and not, because, the reason I thought that made sense was Imagine if your mobility, you didn't do anything to really address your shoulder mobility while you're dealing with this bicep. You start to kind of get back on the path training wise, weeks down the road, and then your shoulder mechanics are crap because you haven't really, moved that shoulder hardly at all for months. I'm going, what a kick in the teeth it would be to then start having to deal with a shoulder injury that, again, was probably caused because that shoulder hasn't been moving, in a meaningful way for a long, long time. And so, again, that's just something so grip training, wrist curls both ways, and just gentle shoulder movement. Those are kind of the four things. The other thing I wanted to talk about are things that I have done kind of outside of the normal protocol for treatment of the post-op care or whatever. My physical therapist, who I've talked about and probably talk about in every one of these videos, because again, if you're in the Atlanta area and you need, send me a message. I will give you her contact information. She's absolutely amazing. Has her own private practice out of a CrossFit gym close near downtown Atlanta. But she's incredible and can work wonders. She's got 3 patients that she's seeing that are coming off of surgeries, 2 her shoulders and then mine. And the progress for all of us, and again, we're talking, I saw her 12 days after my surgery. She said, I could see you as soon as 10, fell on a weekend. So I saw her 12 days after I literally had this thing reattached. I was excited to see her, but at the same time, I was terrified. What are we actually going to do that's not going to be, putting me at risk for, doing something dumb. But she is, obviously she knows what she's doing. So we only did 2 things that first trip. We dry needled. If you've ever had dry needling done, you know that there are different levels of intensity. Sometimes depending on the muscle that you or what you're trying to accomplish with it, the contractions can be violent, very strong, and that's what you're looking for. That's what you want. Particularly maybe if you've got something that's kind of locked up. In this case, that is the opposite of what we wanted. We're not looking for a big bicep contraction. That would be a horrible idea. The idea was just to get to do some very, 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 very light dry needling on the bicep and the tricep, just to get 1 or 2 little baby contractions. And that is, again, I don't have the degree, the education, expertise to explain what it did, but the caveman explanation is, this is going to go to sleep. Your bicep and tricep are going to go to sleep because they are not going to be doing anything for weeks on end. Those little contractions that you're getting as a result of the nerve firing are just to keep it awake, to keep it from almost going into a dormant state or something. And so that was it. We got 2 little tiny contractions on the bicep, 1 little contraction on the tricep, and that was it. That was it for the needling. From there, she did some scraping, which I've been getting some more aggressive scraping. You can kind of still see the remnants there. But the first day, that's, if you're not familiar with scraping, do a search, you'll find, a million videos. But it was very, very light. It's a tool that I'd liken to your ice or windshield, ice is over, you got that little scraping tool. It's like that, but more, suited to the human body. And so she just did some real light scraping right around the surgical site and then on the bicep as well. Super, super light. She did my other arm just as kind of I was actually starting to have some pain because I'm using this arm so much since it's, the only option I've got. So she did some hard scraping there. This arm looked like I'd, been in a motorcycle accident when she finished. And this one just had some real light, markings from, the internal bleeding, whatever, the micro trauma that it causes. And so that was all we did that first time. I've seen her every 7 days subsequent to that. We're doing the same 2 things. The needling is getting gradually more intense, but still very, very light compared to some of the needling I've done in the past. And the scraping is also kind of picking up. You can see I've still got, that was almost 7 days ago, and the evidence is still kind of there. So And then something she gave me to do when I, in between visits, is kind of my own version of scraping. So basically just, take, whatever you want, something so you're not just sitting there rubbing your skin raw. It's like cocoa butter or like coconut oil or something like that. Just something you can rub there so it's not just like biting on your skin. But get a butter knife, use the back side of that butter knife and just sit there and just kind of look at that around that scar site. And, again, you'll feel that tissue is hard as a rock, or wants to be hard as a rock from the scarring. And so that just kind of breaks it up, gets a little blood flow in there. And again, I think that's the name of the game right now. So those, again, if you aren't familiar with someone who is trained and well-versed on those types of therapies, I cannot recommend it enough. Your regular PT is great. There's some advantages to be had there, but these kinds of treatments, the last one that she started introducing 2 weeks ago, I guess was BFR, blood flow restriction training. So she, cuffs the arm right about here. That makes it so all the blood that is out is not able to come back in. It's not able to recirculate back through. So your arm starts turning like purple, blue purple. And you leave that cuff on for X number of minutes. She pulls it off. All that blood comes rushing back down. And again, got no fancy schmancy medical terminology to tell you what that's doing and why it's advantageous. I can just tell you it feels great. And as you walk out of there, it feels great. You'll even you'll see it looks like you actually just did like a little workout or something, because you just get this massive rush back through the area. And so I know people talk about BFR training, like is it good for hypertrophy, like building muscle or whatever, but don't care. I know for rehabilitation though, I think it's great. And if nothing else, if you think it's all pseudoscience, whatever, from a placebo standpoint, all good, man. And it definitely can't hurt anything. So go with that if you're skeptical. So that's it. That's all I was going to do for this go round. And again, I know this might seem a little aggressive, or I don't know. The cool thing about this is, a year from now, hopefully I've kind of continued this process. And again, it's just me with a phone. So again, that's why I probably need to tell you that. It looks pretty simple, right? But these things will or will not pay off, or maybe they won't have any impact. My process of coming back to doing what I was doing before won't be any different than someone who kind of went, by the book from, their hospital, their surgeon and their physical therapist there at the hospital. So we shall see, but for the time being, I would say things are progressing as good. I'd like to think slightly better than is typical for this type of injury. So yeah, the next video I do will be on some of the things that I'm doing as far as training that I have been doing for lower body and one-arm training. And again, that in and of itself, you can find a million opinions one way or the other. There were plenty of opinions not opinions. I mean, these were, MDs saying that you shouldn't do any type of training of any kind for 6 weeks, other than, walking around or something. But again, intuitively, logically for me, if I am exercising in a way that puts this arm in zero chance of being compromised or in an adverse position, I just got to believe there are going to be benefits to that, and that will speed along both the reattachment, what's happening internally, and once I get back to being able to do some more regular things, that process will be a lot smoother, be a lot less susceptible to re-injury or injuring another part of my arm or something that's been kind of compromised these last few months. So I'll show you some of those exercises, and yeah, the next video will probably also include my meeting with my surgeon. So I see him in like 6 days. So that'll be interesting, see what the protocol from his angle is, and what I ultimately end up doing. So appreciate it. Thanks for watching.